72% of the public supports a government health insurance plan, and 57% of the public is willing to pay more taxes for universal health care. They seem to be ready for the kind of changes that Republicans are fighting.
Well, it's just not Republicans, George. The reason you're not going to have a government-run health care pass the Senate is because it would be devastating for this country. The last thing in the world I think Democrats and Republicans are going to do at the end of the day is create a government-run health care system where you got a bureaucrat standing between the patient and the doctor. We've tried this model. People have tried this model in other countries. The first thing that happens, you have to wait for your care. And in socialized health care models, people have to wait longer to get care, and the government begins to cut back on what's available because of the cost explosion. The CBO estimates were a death blow to a government-run health care plan. The Finance Committee has abandoned that. We do need to deal with inflation in health care, private and public inflation, but we're not going to go down to the government-owning health care road in America, and I think that's the story of this week. There's been a bipartisan rejection of that.
Well, you call it a death blow. Let me just press that point. Are you saying now that Republicans, just as we saw in the stimulus, where only I think 3 Republicans voted for the president's stimulus package, if there's a government-run health insurance plan, are Republicans going to vote en masse against this package?
I don't think it's just going to be Republicans. You got Senator Conrad talking about a co-op. You got other Democrats running away from the government-run health care where the bureaucrat stands between the doctor and the patient. I think this idea is unnerving to the members of the Senate, and it will be to the public when they understand what it means, that you'll wait longer to get treated and you'll get the health care the government decides for you, not that of your doctor. So yes, I think this idea needs to go away and replace it with something maybe like Kent Conrad's proposal.
Well, again, I'm delighted to hear Lindsey talk about the possibility of having something like a co-op. There have been nonprofits. I happen to support a public option. I don't think you can bring down cost without it. If there isn't some competition out there to drive down the overall cost, costs have gone up 86% since 1996, 45% in my state alone, increase in health care costs. The American average working family can't afford this. Family of 4, now it's $12,000. We're being told in 20 years it could be half the gross income of a family spent on health care premiums. That is just unacceptable. Now, how we get those costs down? We use a lot of these buzzwords. No one I know is for socialized medicine. We're going to develop a U.S. plan, not a Canadian or UK plan, one that meets our needs in our country, that's designed for Americans by Americans, that isn't socialized medicine. But you've got to drive down these costs. We need quality, accessible health care, and bringing down those costs are absolutely critical, or we're going to bankrupt the country. It's unsustainable. That's why we're at the table.